I'm Jennifer Zeppelin, and we are taking 5 today at Mobile Bay OB-GYN with Dr. Francie Ruzic. Thank you so much for having us. So I understand that January is Cervical Cancer Awareness Month, so I can't think of a better time for us to try and raise awareness about early detection and prevention. So share with us a little bit more what cervical cancer is.
Yes, and thank you so much for having me today. But it is an important thing for us to discuss. So cervical cancer, just like other organs in the body, the cervix is one that is prone to cancer. So just for quick reference here, the female reproductive tract is made up of many different organs. We have the uterus here, also like the womb. We have the fallopian tubes, the ovary, and then right at the bottom of the uterus here is the cervix, which connects the uterus to the vagina. So the cervix can be prone to cancer. Now, there's a lot of different types of cancer, but the most common type is squamous cell carcinoma. And the most common reason for this to develop is a virus called the human papillomavirus, or HPV.
All right. So talk about symptoms. I mean, I love having a little bit of, kind of a prop to be able to share with us exactly, because you said a lot of people don't really know what cervical cancer or what the cervix is. So what are some of the symptoms somebody should be aware of?
And that's the hard thing, is that a lot of times cervical cancer, there are no symptoms, but something that we see commonly is a patient that has not been in to see their OB-GYN in many years, and then all of a sudden has new onset vaginal bleeding after intercourse or just random abnormal bleeding from the uterus. So bleeding would be our most common presenting symptom.
All right. So when we talk about somebody really wanting to reduce the risk of this, what about the age that this happens, or what are some other recommendations you have?
Absolutely. So first and foremost, we want patients to come to see their OB-GYN each year, because at those appointments, we not only do a physical exam where we look at the cervix, but we also do a pap smear where we do a brush of the cervix to help us see if we have any precancerous cells. So pap smears are our number one way to screen for cervical cancer. Additionally, so important for us to know is that we have a vaccine that can actually prevent cervical cancer. So this is called the Gardasil vaccine. Ideally, we want all children to be receiving this vaccine at the ideal age of less than 15, but patients up to age 45 are eligible. So the vaccine is definitely the way to go to help prevent cervical cancer.
All right. But I think, ultimately getting that annual exam is probably the most key thing. Okay.
Yes, ma'am.
All right. Thank you so much, Dr. Ruzic.
Yes,
if you would like more information on getting an annual exam, you can go ahead and call the phone number on the screen, and there's also the website as well. Have a great day.